Imagine facing a steep hike in your health insurance premiums, just as you're trying to recover from years of economic uncertainty. For millions of Americans, this scenario is becoming a looming reality. Senator Jon Ossoff, alongside fellow Democrats, is raising the alarm about an impending surge in healthcare costs due to Congress's failure to extend pandemic-era subsidies that have kept Obamacare premiums affordable. The stakes are high, and the clock is ticking. But here's where it gets controversial. While there's clear public support for extending these subsidies, political gridlock threatens to leave many families in the lurch. These subsidies first appeared in the sweeping coronavirus relief package passed by Democrats back in 2021. Designed to ease financial burdens during the pandemic, they helped lower the cost of health insurance plans purchased through the Affordable Care Act ACA exchanges. For low-income households, this often meant free or nearly free coverage. Middle-class families also benefited significantly, especially those tied to small businesses or self-employed individuals who rely on ACA marketplaces for their healthcare needs. However, without congressional intervention, these subsidies will vanish at the end of this year. Republicans, currently holding majorities in both chambers of Congress and controlling the White House, opted not to renew them when passing a recent tax and spending bill, a move President Donald Trump celebrated as his big, beautiful bill. Senator Ossoff, addressing reporters in Atlanta, urged Republican leaders to reconsider. He warned that Georgians, in particular, could see massive increases in their premiums due to provisions in the Trump-backed budget legislation. Ossoff pointed to analyses from nonpartisan groups suggesting that ACA premiums in Georgia might rise between 20% and 40% unless lawmakers act swiftly. And this is the part most people miss. Georgia residents purchasing policies through the exchange may experience some of the sharpest spikes nationwide. According to preliminary data reviewed by the Wall Street Journal and the Kaiser Family Foundation, KFF, average premium hikes across companies could reach 21%. Some insurers, like United Healthcare, project even steeper jumps, an eye-watering 42% increase for its Georgia plans, per KFF researchers. Extending the subsidies isn't cheap. It would require roughly $30 billion annually from federal coffers. Yet, despite the price tag, there's evidence of bipartisan backing for continuing the program. Polls show widespread approval among voters, regardless of party affiliation. However, GOP leadership remains divided over how or whether to proceed. With open enrollment set to begin in November, time is running out to hammer out a solution. The debate grows more complex when considering differing perspectives within the Republican Party. Take U.S. Representative Buddy Carter, for instance. Running for the GOP nomination to challenge Ossoff in next year's Senate race, Carter argues that priorities should shift away from subsidizing ACA-related coverage. Democrats had the chance to make Obamacare COVID credits permanent, but chose not to, he stated recently. Instead, Carter advocates tackling systemic issues such as waste, fraud, and abuse in healthcare, which he claims inflate costs for vulnerable populations. He criticizes what he calls blank checks handed to large insurers like United, CVS, and Cigna. Meanwhile, another contender for Ossoff's seat, Representative Mike Collins, emphasizes alternative achievements in the July spending bill. His spokesperson highlighted provisions aimed at expanding access to health savings accounts and curbing Medicaid fraud. Measures intended to enhance consumer choice without ballooning the national debt. Right now, too many insurance companies are exploiting patients, said Collins spokesman Corbin Kewen. Representative Collins is committed to holding these corporations accountable and lowering rates for Georgia families. So, where does this leave us? On one hand, extending the subsidies seems like a straightforward way to protect millions of Americans from skyrocketing healthcare costs. On the other hand, critics argue that throwing money at the problem doesn't address deeper inefficiencies in the system. What do you think? Should Congress prioritize immediate relief for struggling families, or focus on long-term reforms to rein in rising medical expenses? Share your thoughts in the comments below. We'd love to hear your perspective.